Now is the first real practical activity of something you'll be able to use when you do your work where there's young people using violence. So the first is an intake. It's very important that you have some sort of intake measure to see how much violence is happening at home, what's the pattern of behavior, and how much risk is there in the family. Also, because of the shame we talked about earlier, mothers are really challenged reporting it. They're afraid their children get taken away. It's the shame of thinking they're failing as a mother. They very are low in reporting adolescent violence at home. So this intake as well can help screen adolescent violence. We didn't even think there was any there, because usually to get a referral of adolescent violence, there is usually some high-end severe physical violence. If you go into a family maybe for something else, some other support need, and you do this intake, you might find that there are issues of adolescent violence at home that come out when you do this intake. So the intake is really important. We have Sarah's case study and how she filled out the intake. Now what you want to do with the intake is you have Sarah's scenario, and she comes in and fills in the intake. Now, when you do this sort of thing, what it is a springboard to further communication. Talking with Sarah about the intake. What behaviors do you want to know more about? What do you want to know more about a context with? What other information is missing? It's really just a springboard to larger conversation. You don't really want to use the intake in and of itself without any discussion with Sarah. So you just have to use the intake. It's going to give you an idea of the pattern and give you an idea of the context. And you're going to want to understand, well, what is going on for Sarah and her children. Also, if there's multiple children, it is good that even though Sarah's coming in for a specific child, her 14-year-old son, even though she's coming in for that son, there might be other children that are using violence as well. And this intake can help bring out some of that, because it's not uncommon if there's multiple children that all of them are using violence to different degrees when they are trying to get what they want, trying to use instrumental violence in the house. Now, the beliefs around violence we'll talk about a little later. Right now, what we want to do is use this example to try and gauge the risk, try and gauge the context around the violence in the house. When you're out in the field, you'll have the similar intake, which, as you can tell, is basically just a breakdown of the abuse wheel and looking at frequency and those sorts of things. But you can use the blank page when you go out. The handout that you have, you can incorporate that with your intake process. But what we want to do right now is pretend that Sarah has come to you, filled out this intake, brought it into the session with her, and now you are looking at what is the context, what do you want to know more about, how are you going to use this intake to get a better idea of what is happening in the family. So you're talking to her about her responses, you're trying to identify the risk areas and what you need to, what you want to find more context about.